Hello, my name is Kit Ipoma, and today I'll be performing administration of intramuscular injection. I have all my supplies here. I have my 2 alcohol cotton swabs. I have my disposable syringe, and I have my needle that I'll be using. This is the 3 mil. And then for intramuscular injections, you want to use a 22 to 25 gauge needle, and that's what I have here. Then I have my hand sanitizer, I have my gloves, my patient, and then I did my dosage calculations on this paper so you can see it. So it's the prescriber's orders, the doctor's orders is the 6 milligrams IM of morphine sulfate for our patient Ms. Poma for right now, and only 1 dose. So because we know that 6 milligrams is that 1 dose that we're going to be giving them, the pharmacy gives us 4 milligrams per 1 mil, so we need to figure out how many mils we'll be injecting. So I did 6 right here, then my 4 milligrams to 1 mil, and then we have 1.5 mils of morphine sulfate that we'll be injecting. So this is what I'll be referring to. Doing my dosage calc, we don't need this anymore. So now I'm gonna go ahead and do my hand sanitizer. I got all my supplies here. I'm gonna go to the medication room and verify the prescriber's orders again. So the doctor ordered 6 milligrams of morphine sulfate IM, just 1 dose for our patient Ms. Poma. So I'm going to confirm the 6 strikes of medication. It's the right patient, Ms. Poma, correct dose, and it's going to be 1.5 mils per dose, okay? So that's the 6 milligrams over the 4 milligrams that we have on hand per 1 mil, and we'll be administering 1.5 mil. It's the correct drug, it's the morphine sulfate. The correct route, IM, intramuscular, we're going to do it on her ventral gluteal site, and then it's the correct time. Do right now, and then we're gonna do documentation on this after. So now I'm gonna grab all my supplies and I'm gonna go into the patient's room. I'm gonna do my hand sanitizer before I go into the patient's room. I'm gonna go ahead and knock on the door. Knock, knock, knock. Hello, Ms. Poma. My name is Kit Noy and I'll be your nurse today. I'm closing the curtain for privacy. Before we get started, can you confirm your full name and date of birth for me? So now I'm going to be looking at her wristband, and she confirmed her full name and date of birth. Thank you, Ms. Poma, for confirming that. So the doctor prescribed you some morphine sulfate. Before we do that, are you allergic to any medications, any food, any seasonal allergies, animals, or anything like that? No. No allergies. So the patient stated they have no allergies. We already confirmed their full name and date of birth, which is their patient identifiers. So now I'm going to go ahead and pull up the MAR or EHR and go through the 6 strikes of medication again. So we went through the 6 strikes of medication, right patient, right drug, right time, right route, right dose, and right documentation. So that's all correct. So today we'll be administering morphine sulfate. That's gonna go on your ventral gluteal site, okay? All right. So before we get started with this, I just want to go over some of the actions, the uses, the side effects, and the adverse effects. So morphine sulfate binds to your receptors in your central nervous system, and it's supposed to change or alter the perception of your pain stimuli. So it's supposed to help your pain, okay? The uses for this is for moderate to severe pain, which is something you have, so you want to make sure that you're getting medication for it so it doesn't hurt as bad, okay? And then some of the side effects you might feel is nausea, dizziness, some drowsiness. Some adverse effects would be a lowered respiratory rate and or respiratory depression. So if you feel like you're just not getting enough breaths in after we give this medication to you, you feel like it's hard to breathe, you're just not feeling right as you're breathing, you will let us know, okay? And then another adverse effect that you might feel is you might faint. You might feel really, really lightheaded. So let's say you're trying to get up and go to the bathroom or do something and you faint, that would be one of the adverse effects. So if you feel any type of uneasiness with your respiratory, or just like your head is not feeling right and you feel like you might faint when you're going to the bathroom or anything, please let us know so I can let the healthcare provider know, okay? Does that sound good? Do you have any questions for me? And I do want to let you know that an hour after I inject this, I will come back to the room to check on you. But if you have any concerns before then, just use your call light and we'll come to you, okay? Does that sound okay? All right. So when I inject this medication, please note that you might feel some slight burning or stinging sensation. And that's a common side effect, okay? Common effect that people have. So I'm gonna go ahead and get my gloves on. It's hard to see. So I'm gonna open this. It's my 3 mil syringe, and then my needle. Alright, now I'm gonna get this one twisted on there. Toss this in the trash. I'm gonna clean the top of my medication vial. Toss. And then now we know that we'll be injecting 1.5 mils of our morphine sulfate. So now I'm gonna get my air. 1.5. It's 1.5 right there. 1.5 on here. So we have that clean. Now we're gonna take off our needle top. There we go. Put that down here because we'll be using the swoop method to recap. Now I'll be injecting our vial of air. Our air. There you go. Push this down. Now we'll be inverting. And now we're going to be getting 1.5. Okay, now I have a bubble on here, so I'm just going to go ahead and tap it. I have a big old bubble in there, so now I'm just gonna inject it back in there and try to pull it again. And then, there you go. I got my 1.5. There you go. And now I'm gonna go ahead and recap the needle. I wanna show you that 1.5 on there, and there's no bubbles, no present bubbles. And we're gonna recap. Then if we're doing this away from the patient's bedside, we wanna write their medication, the dose, and the patient's initials and or name on here so we make sure we're giving it to the right patient. I'm gonna put that down. Go ahead and do this. So I'm gonna go ahead and assess their site that we'll be injecting. So we wanna do it in the ventral gluteal site. I'm gonna use the heel of my hand on the patient's greater trochanter, and then use my thumb to point towards the groin, and then use my index finger towards the iliac spine and my middle finger towards the iliac crest or the buttocks, okay? So just like this, so I'm pointing it like this, and it's gonna make a triangle shape. So in that triangle shape, that's where I would want to inject the medication, the IM injection. So it'll be right here, okay? So I'm gonna go ahead and assess their skin. I'm assessing their skin for any tenderness, any redness in the area, and I don't see anything. The skin integrity is nice. There's no edema, there's no lesions or anything, and this looks like a good site, okay? So yeah, so now I'm gonna go ahead and clean the patient's site. And in that triangle shape that we saw, okay? We're gonna start from inner and go out about 2 inches, and then toss this into the trash. So now that we're gonna wait for the patient's skin to dry, and I'm gonna let the patient know, again, you might feel some slight burning or stinging sensation when I inject this, but please let me know if it does hurt really bad, okay? So now I'm gonna use, I'm gonna wait for that to dry, it's still a little wet. So this is my hand that I'm gonna use, and I'm gonna hold this guy like a dart when I inject it. And I'm gonna use my other hand to hold the skin, back so there's some tension there, so I'm able to just put the needle in at a 90 degree, okay? So I'll be holding this side of my hand right here. I did not uncap it yet. So it's still in that triangle. I waited for it to dry. Now I'm gonna go ahead and remove this cap. It's hard to remove it. There you go. So now I'm gonna hold the skin up, and I'm gonna make sure I'm going in that triangle area. Skin's all dry, looking all good, and I'm pulling the skin back, okay? Then I have my index finger here and my thumb here. So now I'm gonna go ahead and inject straight down 90 degrees. And then I'm gonna wait a little bit and aspirate, push and aspirate to see if there's any blood. There's no blood, so I can go ahead and continue with the injection. So now I'm gonna hold it. And then we're gonna inject 10 seconds per mil. Okay. So I'm gonna go ahead and advance, and I'm gonna hold it. There we go. I'm injecting 10 seconds. 7, 8, 9, 10. I'm holding it to stabilize. I'm doing this. There you go. Then we're gonna go ahead and wait 10 seconds. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. Then I'm gonna go ahead and remove the needle. Put it in the sharps container. It's in the sharps container. I'm gonna get a clean alcohol swab, and I'm gonna put it on the site of injection. I'm not gonna rub it or do anything like that, because we don't want to irritate or move anything around, so we'll just leave it like that. It's all good. There's no excessive bleeding. We're gonna take it off now, toss it in the trash, throw my gloves away, do my hand sanitizer. Okay, Ms. Poma, we are all done with your injection. Do you need anything right now? All right, I'm gonna leave your call light next to you. The patient's all good. I'm gonna go ahead and document my procedure, and I'm all done.